My TV audience has heard me say this many times, but many of you are too busy to watch television, so I'll repeat it, that I believe that a physician has a responsibility to tell patients what they need to know, even if the message is uncomfortable. So here's some painful truths that should concern everyone in this room. I'll list them quickly. Healthcare expenditures are growing 2 to 3% faster than our economy. Not sustainable. The Medicare Trust Fund will be insolvent within a decade. That's the 2.9% taken out of your paycheck. Medicaid is the #1 expense item in most states, consuming 30% of those state budgets, and that's crowding out essential services like schools and public safety that many of you spent your careers trying to develop. A healthcare cost per person in this country is twice that of other developed nations. So it's not just about the money. We're already putting twice as much money into the system. Why is it costing us so much? Because of chronic disease. And those chronic diseases, and we made it easy to be sick in America, are linked to poor lifestyle choices, and they drive 3/4 of the $1.7 trillion that CMS spends a year to support Americans' health. 43% of Americans are obese. That's the major driver of those lifestyle chronic morbidities. That's quadrupled since I was in college. More importantly, we're twice as obese as Europeans. We're 9 times as obese as the Japanese. And 3/4 of our young people cannot even qualify for military service. Our maternal mortality rate, and I want to hammer this point home because we talked about it, and Senator Hassan, we talked about this, well, she slipped out, but she was there a second ago, it puts us in dead last place behind 50 other countries, maternal mortality rate, women dying during childbirth. Medical errors, #3 cause of death in America. These are some of the reasons why our life expectancy is now 5 years shorter than comparable countries. This public health crisis threatens our national security. Why? Because it adds to the national debt that is defeating us from within, crowding out other essential services. And we are, in addition, witnessing fellow Americans suffering needlessly, which I believe is a moral failing. As a heart surgeon, I can attest that the most expensive care we give is bad care. You pay to do the wrong thing, you pay to fix what was done wrong, then you pay to deal with all the complications. It's immoral, it's wrong, and it's expensive. We have a generational opportunity to fix our healthcare system and help people stay healthy for longer. That's why President Trump wants to love and cherish Medicare and Medicaid, because he believes every American should get the care they want, need, and deserve. Now, to achieve this mission, CMS should work with Congress to find efficiencies that can help stabilize our insurance markets, which will make it easier and more affordable for Americans to adopt healthy lifestyles.